not feeling it.
There we go. Let's back that music off just a little bit.
A little. Just take it down. Take it down. Hey, how you doing this morning?
Hey, everybody. Welcome into the Exiles podcast. Coming to you.
The Franzinator was substituting for Brian on Talk 107.3.
Talk 107.3. What is that?
It's this radio station. I've heard of it.
Wow.
But anyway, I decided to give him a listen on my way over here to La Divina. Please come join us for breakfast. Great food, great hospitality. And of course, for the ladies, you get to look at Lance. But anyway, Franz is like coming out of the 7 a.m. break. And he's screaming, hey, hey, hi, ho,
He's flame throwing.
Yeah, and it's like, I sent him a text, said, cheer down.
Yeah. Dial it back. It's talk radio.
Oh, stop all the enthusiasm.
I think that Franz is he's excited to be asked to guest host
He
for
is
a full-time
excited.
guy, and he wants to give it his all. We haven't spoken with Franz in a few weeks, so we'll have to get him back on the podcast or back on the TV show.
Yeah.
And to have a chat. A lot of legal matters I'd like to talk about. Some I don't think he can because some of those people are his clients. Yikes.
Well, you know, the woman that beat on the truck with the bat and then produced her own gun, and we find out that she is an elementary school teacher. And
We'll need that in a moment.
Will I?
Yeah.
Is this a prescription?
No, that's the phone number to dial a guest we're bringing in.
I thought it was a prescription.
We're bringing a guest in telephonically this morning.
Won't that be fun? But anyway, she has retained counsel. She has retained Franz.
Franz is a good defense attorney.
He is.
What I saw in that video, though, I'm not sure. I mean, you know, the video, there's always more to what happened than the context of the video.
Yeah.
There's always what happened before somebody decided, oh, shit, I better get my phone out and be recording this. There's always that. And then there's always what happened after the end of the video. Unless the video ends with the car rolling off into the sunset. But that's gonna all come into play.
Everybody's entitled to a defense.
Yeah, everyone's entitled to a defense. And she's got a good defense attorney.
What was it, Cheech and Chong? You know, in the court.
I was framed.
In the courtroom scene. I plead insanity, Your Honor. Insanity. Yeah, I'm crazy about them young girls.
Yep.
I would go with the diminished capacity defense, just based on what she was wearing.
Today
Either
on
that
the
or the no
program,
mirror at home defense.
as sick and tired as I have gotten of talking about COVID-19, we are going to talk about COVID-19 a little bit today. And Bill is going to step away, and he's going to get our guest on the telephone, and through the magic of Bluetooth, we're going to talk with our guests via the telephone on the program. But I'll get a little bit to get them all set up. Dr. Keith Smith is a board-certified anesthesiologist and the co-founder of the Surgery Center of Oklahoma. And we're going to be talking with him about getting rid of some of the barriers between patients and doctors and how that can improve health and save lives in the COVID crisis. Also, okay. Well, you won't be able to hear him anyway, period. But I won't be able to hear me if it's in queue. He's on the phone. Yeah. Hey, Dr. Smith, are you with us?
Yes.
Hi, Kevin Gallagher here, along with Bill Profita. As I was saying, Dr. Keith Smith it basically says it's time to let doctors lead the post-COVID reforms.
And Dr. Smith, I read your bio, and one of our favorite senators, Bill Cassidy, who is also a physician, has very strong feelings about one of the groups you advocate with, and that is for transparency in medical costs, as you have with your clinic. So if time allows, I'd like to get to that as well.
Yeah, I'm happy to talk about it. I'll follow your lead. We put all of our prices online on display for everyone to see about 11 years ago. And it's changed the marketplace here locally, but it's also given patients an opportunity to show those prices to their local price gouging hospital and give them an opportunity to step up the plate and match our price so that the patients don't have to travel to Oklahoma City. It's been very, very powerful, very informative.
What do you think the resistance has been? Now, you are a specialist in anesthesia. That is one of the specialties that that generally the physicians who practice it are well compensated because you have to have a very high level of skill. It takes a long time to become an anesthesiologist. What do you think the resistance has been for your peers and your colleagues to actually post the fee schedule?
Well, I don't know that there is much pushback from the physician community about transparency. The pushback for transparency and pricing has come from the institutional side, from the hospitals. And the reason that they are pushing back is they're making so much money under the current system of rules that are just a manifestation of an auction that's gone on in Washington, D.C. for decades. So all these favors, all of these rules that help the existing players and hamstring the upstarts and the underdogs, all of that tends to decrease market competition and drive prices higher. So, no, I mean, these big box hospitals, they don't want to see anything change. They're making huge money, and I would encourage people not to fall for the poor-mouthing propaganda that they hear from these big hospitals every day.
I have a friend who is a board-certified dermatologist, and many years ago, we were all having dinner, and we were talking about when they first started talking about medical centers buying practices and changing the fee structure. And he got very indignant. He said, I've been in school for 28 years. I deserve to be well paid. Now, he has moderated that a little bit, but someone like you, been around the block a few times, how do you determine when it's just outrageous in terms of compensation, either for the provider or for the hospital?
Well, your friend does not deserve anything. The market determines what value someone provides, and the only way it can do that on a rational basis is for there to be open market competition and visible pricing. There may be some surgeons or anesthesiologists who are so skilled that their service is actually worth paying more for. So the market really has to be allowed to work, and those who are the outliers, the more egregious price gougers, will become very apparent. The way things work now in the United States, the higher the price, typically the worse the quality. So there's actually, this is very paradoxical, there's an inverse relationship between price and quality in the United States. And the reason for that, if there's not much market competition going on, if there's say a city that has a monopoly by a big hospital system, they don't have to be any good. And they don't have any competition. Their prices are ridiculous. And if prices are lower, that usually means someone is in there mixing it up, trying to compete, and they have to compete on quality too.
The question we would have, I guess, is, and I understand your assertion, and I think a lot of people feel the same way. But is this diminution in quality by design, or is it just a byproduct of turning the business side so much that you're not keeping up with the professional standards side?
It's a byproduct of lack of accountability. If someone opens a competing business to you across the street, you suddenly are faced with the realization that I have to be good, I have to treat my customers right, and I have to deliver a quality product or service. If not, you'll lose all business. When you have monopoly setups, and the reason these hospital systems have a monopoly or a quasi-monopoly many times is that they purchased all kinds of favors to ensure that that's the case. And they don't have to be any good. And it actually takes dedication and focus and sometimes money to be good at what you do. But if you're unaccountable and you're going to get patients flying through the door, coming to see you for care, whether you're any good or not, then people tend to just not focus on that.
You are in a private surgical center, and we have a couple of them here, and I know it's a very, very expensive proposition to own and operate one of those, as we move forward with a healthcare model that is increasingly appearing to be broken. Does that mean that you have given up your privileges at the big medical center hospitals, that you practice strictly where you can control prices in your surgical center?
Yes, I am full time at my surgery center, but all the surgeons that work at our facility, and there are 112 of them, they all have hospital privileges somewhere else in the Oklahoma City area. So we realized we would not be able to control the prices to which our patients were exposed unless we controlled the facility, unless we controlled the institution. And so we disintermediated the process by owning and controlling the facility where we work. And that way we can be in control not only of the medical aspect, but we can also be financial advocates for the patients that come here.
Doctor, and by the way, thank you for coming on the program with us. Let's move over to COVID-19. I'm reading in some of the material that was sent to me by your booking agent that you said that, the government's handling of COVID-19 has largely been a failure, but they did one thing right. What has the government done right with COVID-19?
Done a couple of things right, and of course it's completely unintended. But fortunately, government is so inept that there are unintended consequences that work in our favor.
Even a blind squirrel finds a nut every now and then, right, Doc?
Broken clock, right? Twice
right.
a day.
That's right. Yeah, so they've really exposed the extent to which government regulations have interfered with the relationship that physicians and patients can have, and many of the regulations that prevent patients and physicians from dealing with each other in a rational way had to be relaxed in order to cope with what was going on. Telehealth is one of those examples, and there are many others that are being looked at. Had we not pushed the FDA and the CDC aside, we would still be waiting on testing for COVID-19. And the CDC, by its own admission, the first tests they sent out, a large number of them were actually contaminated with COVID-19. Mm-hmm. So government doesn't get anything right, and I think that's one of the revelations of what has happened in the last few months.
So from this point forward, would it be better for government to step back? I mean, we've got lockdowns, we've got mandatory mask orders, we've got, it used to be if there was something going around, a pandemic or an epidemic, and I thought maybe I'd been exposed, I'd call my doctor. And the doctor would decide whether he wanted to see me and risk infection or just, prescribe me something. But now it's like you don't get to see your doctor. You get to do a drive up in a hospital parking lot and have somebody shove a swab up behind your eyeball. It's like, could it be more depersonalized?
Yeah, I mean, it's the answer to should the government step back is always yes. I mean, that would be my default answer to that. But with relaxation of the federal regulations that either pay for or regulate the privacy of the medium that's used for telehealth visits, then telehealth visits became more commonplace, and it's really that it's safer for everyone involved. But of course, the government's always in the way. They always regulate, and I actually prefer to call regulations choice restrictions, because there really is no reason the government should be in the examination room as an intermediary, supposedly protecting us from, whatever vendor or physician we're dealing with.
Dr. Smith, you may have heard about this. We had them on our show and on our television show as well a few weeks ago when you were talking about contaminated tests, when we weren't getting testing going. We actually had two virologists from the LSU School of Veterinary Medicine, a clinical pathologist from the largest freestanding women's hospital in the world, and an infectious disease specialist from LSU Medical Center. They basically went around all the regulations and not only invented the test, but the transfer medium, and had it in use in about 72 hours. And that's pretty amazing. And that's like we're going to ask for forgiveness rather than permission when it comes to things like the FDA. I think that's a pretty good example of what you're talking about.
Yeah, when the chips are down, the American people are fortunate. They can turn to innovators and entrepreneurs like the folks you've just described. And there are countries like Venezuela where the market has been destroyed and stifled, and that's sort of a who do we turn to for salvation? That sort of opportunity is not there. This spirit of entrepreneurship and innovation is alive and well in the United States, and if the government will get out of the way, it will flourish, and people will see responses like you've just described, and in every other industry where government would step back.
If you don't mind, speaking of COVID and medical care and all that, I have just been intensely curious about this, and it's closer to you than it is to us. Just up the road in Tulsa, or is that down the road from where you are? But nearby, we have the premier quarantine center in our nation. It's being operated by one of the medical schools there, one of the universities. Have they been taking patients, or are they sitting idle when this has been going on?
I don't have any idea. It's hard to know what to believe. There was one hospital, one hospital system in Oklahoma City that shut down one of their hospitals to be the recipient of countless number of COVID patients. It never materialized. But they received, I believe it was $21 million from the state government for shutting down.
Wow.
And they promptly laid off all the staff. So that was $21 million net because they had no expenses after they laid all the staff off.
That's insane.
So when you hear that, there's a dedicated COVID hospital or there's a dedicated quarantine hospital, in Tulsa or in Oklahoma City, I'm kind of scratching my head. Whenever anybody in government, even if it's an epidemiologist or some so-called public health expert is speaking, whenever they're speaking, they might be telling us the truth. My default position is, in all likelihood, they have a conflict of interest and they're probably lying. I might be wrong, but history's on my side. Whenever the public health experts speak, they're speaking after they look through a lens that considers us all members of a herd, members of a group in the aggregate. And I prefer to think of individuals, not members of groups. So that's just not how these people think. And so when they throw out all of these statistics, it just leaves you kind of scratching your head. Even the CDC has admitted that they are now including antigen and antibody tests as new cases. Well, an antibody test that's positive means you've been exposed to it in the past. So It's not a new case. So it's really hard to know what to believe, but I tend to disbelieve people who are self-declared public health experts.
Dr. Keith Smith is our guest, and Doctor, been very, very enlightening. I don't know if you've taken a look at our Senator Bill Cassidy, who is also an MD, his moves to try to get actual legislation for what you're doing with prices. But I think you might find it interesting, and I hope we can talk to you again, particularly as we get further down the road away from COVID and more into this pricing stuff, because I think the public wants to hear from you and other professionals on this matter.
I'd be happy to visit with you again. I appreciate your having me.
And we appreciate you being our guest. We will talk again, sir. Dr. G. Keith Smith has been our guest. He is a anesthesiologist, co-founder of the Surgery Center of Oklahoma. Dr. Smith, have yourself a great day. Stay healthy, please. We are going to take our little mid-podcast break here.
Hey, Franz is in the house.
Might see if we can get Franz to the microphone to talk.
Or is that Brian Haldane? I'm not sure. I can't tell them apart anymore.
That'll be coming up. We're going to take just a brief pause, and we'll be back in 3 minutes.
Stick around.
Exiles podcast continues.